Hello guys, and welcome to this video to see all the clinical steps to replace this class 2 distal occlusal restoration that was broken and of course due to caries as well. So now first we need to check the radiographic conditions and the clinical conditions, and then you can do this even with the rubber dam. We are going to show a case as well by our collaborator Dr. Victor Haga, but in this case of this restoration I am the patient and no rubber dam was used, only relative isolation. And of course the root canal was treated, there were no periapical lesions, but this restoration was broken due to recurrent caries. So now we need to remove all existing recurrent caries and any enamel or restoration without structural support, right? And that's exactly what we are doing now. So at this point, there were caries yet, although the root canal was treated and of course the cavity is now deep. If you guys don't remember how to differentiate caries from dentin, go back to our video about this. I'm going to add the link on the top right corner of this screen. It will show up at some point, okay? But now we need to continue removing these caries. So now Dr. Juliano Nocortes is showing to you how to use the slow speed with a spherical burr, making sure that there is water all the time, and then avoiding hard pressure and avoiding heat in the tooth, of course. So now the leaning movements back and forth, always trying to maintain and preserve the tooth structure as much as possible. Now after rinsing, of course, drying before checking with the mirror again, okay? So you always need to dry to make sure that you are able to see what's going on. Now, of course, that's a class 2, so we need to use matrix and wedge. Don't forget the wedge, because you may end up with overhangs, okay? So drying and making sure that you are ready to do your very nice restoration using composite resin. As a patient, I felt that it was too tight on my tooth, this matrix, but of course it was bearable because I know that the margin is very low, especially the distal margin, and of course we need to deal with that. Now there are some important aspects about the treatment plan. We need to know if we need to remove all the affected dentin. Of course the infected dentin we need, but the shades of dentin might be darker, especially close to the root canal area. And to learn this, let's take a look at this case by my former student Dr. Victor Haga, and take a look at this. He is using his very nice skills to use the rubber dam even for these class 2 restorations, and now we can see the shades of dentin, which is darker at the floor of the pulp chamber. But let's go back now to our case here, and the next step is of course the etching, and that's the total etching. We are using the Ultra Etch from Ultradent. That's a 35% phosphoric acid material, and we need to wait 15 seconds, of course. Now take a look how Dr. Juliana will rinse without the acid reaching my soft tissues, which could give me a bad taste. So that's very important for you to offer a better comfort for the patient. Take a look at this. Of course you can work with a dental assistant, but if you have the rubber dam, it's better, of course. So now the next step will be to perform the relative isolation with cotton rolls. You can even use holders for the cotton rolls, or you can manage to use the retractor like this one, the umbrella, to hold the cotton rolls for you, and even to help your dental assistant for you to have better conditions to work. Now we have a not so dry surface and we are ready to apply the bond material, which is this one, the PEEK Universal Bond from Ultradent, which comes with this tip. And if we don't have this tip, then we need to use the micro brush, because it's important to brush. Take a look at this. To brush on the cavity, to rub the liquid on the cavity, and then to thin dry. You need to air dry like this, because it's important to avoid a huge thickness of bond material, which is not favorable for your restoration. Then, after air drying, you are going to look with the mirror and you need to find a shining surface. That's what you want to find. Then you need to light cure the bond, of course, and then we are using now the Valo-X from Ultradent, which has two different intensity protocols. And it's very good that you use a good device, then it's very effective when you light cure your bond material and even your restoration, which by the way is the next step. And now we are using the Transcend composite resin from Ultradent, which has a nice consistency when you try to pack, to condense this material onto the cavity, okay, like this. So of course not with a very strong pressure, just firmly, of course, with a firm pressure. Of course, there are several types of plastic instruments, and even those sharp instruments to remove the excess from lateral ridges, for example. But you need to make sure that you are using instruments of high quality, because it makes difference on the final result. Now light curing the resin. And now applying the next increment. Don't forget that this is the incremental technique. There are several advantages of this technique. You guys can go back to our videos on Class 1 restorations, for example, on mannequins, on dental study models. Of course, we should use the plastic instrument parallel to the cusps to make sure that the limit between the remaining tooth structure and your restoration is going to be natural. Okay, so there are several techniques to do that. Now take a look. Even before testing the occlusion, she will perform a little bit of finishing here, but even the burr is parallel to the existing cusps to make sure that the anatomy of the tooth will be respected, all right? And also don't forget that after finishing, you need to do polishing, otherwise it will be too rough for the patient. The tongue of the patient will feel this rough surface and then the patient will complain likely. So now, after removing the retractor and the matrix, articulating paper first in centric, okay, like this, and then in excursion, then in lateral and protrusion, because this needs to be in different procedures, and especially with different colors if possible. Now testing the working side, take a look at this. Now the non-working side, there should be no contacts, of course, and even the protrusion, if you want. But of course, we expect the patient to have incisive guidance in protrusion. If you guys don't remember the principles of occlusion, go back to our video about how to adjust the principle of occlusion on your patient during your occlusal adjustment, okay? A very important video of our YouTube channel. See you guys in the next videos.